And there's also behavior problems in an otherwise physically healthy child that could lead to mental illness. You have the outwardly signs of difficulty where kids are acting out or misbehaving or being disruptive or just defiant. They could be exhibiting this behavior at home, in school, and that could affect their grades and self esteem. They could be experiencing truancy a lot because they're not, um, feeling comfortable in school. There's also a lot of animosity and fighting and things of that sort amongst their friends. It could be from physical stress. It also can be from emotional stress, which all those things we mentioned before, the acting out, not being in school, failing, maybe not getting at home, not getting along well with people at home, all those things could lead to emotional stress. And then there's the biological component, which is the abnormal functioning of nerve cell circuits and pathways that connect particular brain regions, like I spoke about before. It could be brain defect or injury. Genetics could be hereditary, passed down from one generation to the other. Infections, infections can be bad enough they will affect your brain. You have prenatal damage, of course, while you were being carried in your mother's womb. Substance abuse, abusing drugs, alcohol, poor nutrition from when your mom was pregnant, and exposure to certain toxins. Next, I'd like to talk about the common childhood mental illnesses and developmental disorders. There's depression that I think a lot of us experience, it's in several times in our life, but the difference with those who suffer from depression, they have like long extended periods of depression. Their mood changes drastically. They don't want to be involved with things they normally would like to do, such as activities or being around people, stuff like that. You have schizophrenia, bipolar disorder. You have anxiety disorder, which is the leading cause of mental illness, like I spoke earlier. Then you have autism, which is basically a deficit in social communication and social interaction and repetitive patterns of behavior, interests, things of that sort. And it's also known as pervasive developmental disorder. You have attention deficit, hyperactivity disorder, you have learning disabilities, adjustment disorders, and you also have oppositional defiant disorder, which is basically what it is being a defiant, not really want to conform to the rules of society and things of that sort. And then you have conduct disorder, and then you have your eating disorders, which of course is anorexia and bulimia that a lot of our young girls and a lot of our young boys are dealing with. Now I'd like to talk about the underlying factors of why our children are experiencing mental illness and disorders at such a young age. First, there's child abuse, which could have a negative effect on your physical development. This is basically due to physical trauma, blows to the head, blows to the body, violent shaking when the children are very young. And then there's sexual abuse, which are being perpetrated by other children, caregivers, and the parents as well. And you have neglect, which is inadequate nutrition, which could be on the part of the mom when she was carrying the child, and also once the child is born. You have lack of adequate motor stimulation. So that means the child is not getting any interaction, basically, or not developing well. Um, and then you have the experiences that can these the repercussions of all of this can lead well into adolescence and adulthood. Then you have exposure to the family violence, which could be any number of things: drinking, physical violence, things of that sort. Then you have homelessness. And homelessness is usually the result of all the things that I just mentioned before, family violence, sexual abuse, neglect, things of that sort. And then there's the emotional effects, of course, which is isolation, fear, lifelong consequences, once again, that lead well into adulthood, and low self esteem. You have depression, and then you have a lot of times the kids have relationship difficulties in school, at home as well. These are some of the symptoms that is usually evident in children who have mental illness, and things that parents and caregivers should keep an eye out for and watch out for, and could be a matter of concern. And these are changes in school performance, falling from A's and B's of that sort down to D's and E's and F's, abuse of alcohol and drugs, self-loathing, lack of coping skills, changes in sleeping and or eating habits, excessive complaints of physical ailment, defying authority, truancy, stealing, property damage, intense fear of gaining weight, prolonged negative moods with poor appetite, thoughts of death, frequent outbursts of anger, sudden and prolonged loss of interest in friends and activities, significant increase in time spent alone, excessive worrying or anxiety, hyperactivity, persistent nightmares and or terrors, persistent disobedience and or aggressive behavior, frequent temper tantrums, and hallucinations. Like I say, these are just some of the symptoms that you want to watch out for, because a lot of times the kids, they will not verbally tell you what's going on for lack of not wanting to get any help, or just things they don't want to talk about at a young age a lot of times. So watch out for things like that. Next, I'd like to talk about the treatment of mental illness for our children. And unfortunately, the treatment for children is not as well understood as it is for adults. And many of the treatment options and medications that are being used for adults are the same ones that they are using on the children. And some of these medications consist of antipsychotic, antidepressant, anti-anxiety, stimulants, and mood stabilizing drugs. And then you have your psychotherapy, which is basically counseling. And you have the supportive counseling, which basically consists of positive reinforcement, guidance, reassurance, and encouragement. And then you have the cognitive behavioral therapy, and that basically focuses on the relationship between your thoughts, your feelings, and your behaviors. Because in a lot of instances, how you perceive things and how you feel about things, that can have a basic impact on your behavior and how you react to different things. And then you have the interpersonal, the group, which of course includes other people who might be dealing with the same issues as yourself, and your family therapy, which includes the family. And then you have your creative therapy, which is your art. That consists of arts and crafts, drawing, painting, things of that sort. Then you have your play therapy, and that's where you're basically acting out your problems and your issues, and just a way of expressing yourself. I believe the outlook for our children who is suffering with mental illness can be a positive one. I also believe it's going to take a joint effort to include our families, our parents, therapists, doctors, and people who are just genuinely concerned about the well-being of our children. And that of course is to include the educators as well. If our children are treated appropriately and early, many of them can fully recover. they can also successfully control their symptoms, and more than likely, this will involve some medications and some therapy and things of that sort. And some of our children who don't get, who might not get the proper care and treatment when they're young, or who just might have a chronic or severe disorder, will cross over into adulthood. And many are able to live full and productive lives even now. And I know the girls that I work with at the home, 13 to 18 years old, they are experiencing a lot of the symptoms that I've talked about already. But they go to school every day, and a lot of them are pretty smart. They deal with a lot of things, have a lot of things on their plate. They've been through a lot, but they're pretty smart. And most of them are planning on going to college and being a productive member of society. So I think that is a positive thing we can look forward to. Unfortunately, there haven't been a lot of research as far as children and mental illness. Well, not as much as it has been for adults, but in the realm of the research, they are focusing on childhood development. So they trying to figure out exactly what is considered normal and abnormal. So that's one of the things that they're trying to work on and determine. And then they trying to understand the factors affecting development and the impact on mental health. They're also trying to predict problems that could arise, or problems that could affect our children in such a way that they will experience um, physical development, negative physical development, and negative mental development, and things of that sort. And they also trying to find out how they can prevent developmental problems. They're very much interested in identifying all of the risk factors that can predispose our children to mental illness. And then, of course, they want to do some more extensive research on different types of medications that they could use, and hopefully not use the same kind of medications that they have been using with the adults. My last slide I titled Hope, because I want everyone to keep hope alive, and keep a positive attitude, and hopefully our children will not have to be dealing with all the problems, all the factors, and everything that's associated with the causes of mental illness. Most mental illnesses are caused by a combination of factors and cannot be prevented. And that's basically because we can't control households, we can't control families, we can't control, how people are treated. Um, we can only hope that, people out here are getting the necessary education and things that they need to better deal with our children and take better care of our children. And if the symptoms are recognized and our children receive treatment early, many of the disabling and distressing effects of mental illness may be prevented or minimized. So hopefully, through the research and everything, they can identify these factors much earlier than they are now, and like you say, be able to prevent some of these factors. And then we have to focus on our mothers and our fathers, of course, during pregnancy. That plays a big part of it, if they get the proper nutrition from the start. So everyone, let's keep hope alive and pray for our children. Thank you.